Hi, my name is Andrew Williams. This is my head-to-toe assessment for nursing 333. I would come in first to introduce myself to the patient, let him know who I am, let him know of the procedure that would be going on. Start off, talk to him. I'd have him identify himself, give me his name and birthday, double check that with his armband to make sure I'm on the right patient. I would ask him a few questions about his mentation, why he's here, what's going on with him. And I'll be talking to him throughout and just to kind of gauge his mental status, to make sure he's alert and oriented, to check his mood, his affect, to see how his mental health is. Also throughout this, I'm going to be looking at all his body systems and inspecting his skin. So I'll be looking to make sure there's no lesions, major breakdown, looking at the color. When I'm palpating, I'll be checking for temperature and moisture, and that'll be going on throughout this inspection. So I introduce myself, let him know what's going on, and we'll start off with the head. I'm going to inspect his cranium, checking for any abnormalities. I'll be palpating. When I inspect, I'll note the size. With the palpation, I'm feeling for abnormalities, seeing if he's tender at all. I'll be checking the hair for color distribution, texture. When I'm done with that, I'll move down to the ears. I'll take a light and an otoscope, hopefully, and I'll check inside the ear. Looking in the ear canal for redness, swelling, looking for any discharge. I'll palpate outside of each ear, checking for tenderness. I'll go over to his eyes, and we'll start again. I'll shine a light in each eye. I'll do that twice, looking for pupil constriction and making sure that the opposite pupil contracts when I shine the light in the other pupil. I'll also do the extraocular movements. I'll have him follow my pin light up and down and side to side to make sure his eyes move in all the 6 cardinal directions. From there, I'm going to move on. While I'm looking at that, I'll look to make sure he's got a bilateral blink reflex. We'll move down to the nose. I'll look inside of each nair, looking for any abnormalities, any breakdown, making sure they're patent. I'll occlude one at a time and have him breathe through it. And then we'll go down to the mouth. I'll have him open his mouth, have him say ah, stick his tongue out, move it from side to side. I'll also look inside the mouth and look at his teeth, see what condition they're in, if he has any at all, checking the mucous membranes for moisture. As well, I'm going to have him smile for me to make sure that's equal. I'm going to have him lift his eyelids, puff out his cheeks, make sure it's equal bilaterally on each side. From there, we're going to move down and go to the neck. When I go to the neck, I'm going to start by feeling for his lymph nodes. I'm going to check around the ear, down the neck, and under the jaw, asking him if there's any tenderness, feeling for swelling. If I can, I'll get behind the patient to palpate the trachea and the thyroid gland. With the thyroid, I'm looking for enlargement, nodules, and any tenderness. While I'm here at the neck, I'm going to palpate each carotid pulse, checking for both sides. I'm also going to listen with the bell of my stethoscope. And I'm listening for a bruit to see if I hear a bruit. I'm also, while I'm here, going to have him shrug his shoulders to check to make sure that he can move those against resistance and it's bilateral strength on each one. We're going to go down to his respiratory system. I'll let him know that I'm going to pull his gown down a little bit so I can see his chest. I'm going to inspect it first. Making sure there's no abnormalities that are visible. I'm going to make sure it's good, equal chest rise bilaterally. I'm going to palpate to feel for any fremitus. And we're going to percuss. I'm going to percuss and listen for resonance. I'm going to go side to side, comparing each spot on each side. After percussing, we're going to auscultate the breath sounds. I'm going to try to listen to all fields. And I'm going to have him take a breath for each spot that I listen to. And we'll also compare those side to side bilaterally. As well as he can, I'm going to have him sit forward, and I'm going to do the same to the back. The posterior thorax I'm going to inspect, looking for abnormalities. I'm going to palpate for tactile fremitus. I'm going to percuss side to side, checking bilateral equality, and I'm going to listen and have him take a deep breath at each spot I listen to, hitting all lung fields. After I'm done with the respiratory, I'm going to move over and take a listen to his heart. I'm going to listen at the apical pulse for a minute to get a good apical pulse, and then I'm going to use the bell of my stethoscope and listen at the 4 valve sites to hear for any abnormalities. When we're done there, I'm going to cover him back up. And then we're going to slide down to the abdomen. I'm going to make sure he's covered to maintain his privacy. With the abdomen, I'm going to inspect again first. I'm going to look, make sure there's no visual abnormalities. Then I'm going to auscultate next. I'm listening to all 4 quadrants. Listening for bowel sounds. And also on there, I'm going to use the bell of my stethoscope. Right above the umbilicus, I'm going to listen for the abdominal aorta to see if I hear a brewing. And then to each side of the umbilicus, I'm going to listen to the renal arteries. When I'm done there, we're going to percuss. I'm going to percuss in the areas. And then we're going to palpate. I'm going to palpate, lightly palpate all quadrants, looking for any tenderness, asking if there's anything tender, and feeling for any abnormalities, hard bodies under the skin. Have him covered back up. Once we're done with that, I'm going to move on to my extremities. In each extremity, I'm going to check for pulses first. I'm going to do the brachial on each arm, the radial, and also at the fingers, check for capillary refill. Move down to the legs, I'm going to check the popliteal, or the femoral first, and then the popliteal. Under each knee, the posterior tibial, and the dorsalis pedis. I'm going to check the skin condition, color. I'm going to look for any swelling noted, especially in the lower extremities. That might be indicative of cardiac problems. I'm going to check range of motion with each extremity and the strength of it. Make sure we can lift the arms up, move the legs, bend at the knee, make sure there's full range of motion. I'll have him grab my fingers and squeeze, make sure the bilateral strengths are equal. Same with the feet. I'll move down and have him move up and down against my palms. I'll also check the deep tendon reflexes, check the brachial here, and have, if we could sit him on the side of the bed to check the patellar reflex. So that basically finishes up my head-to-toe assessment on this patient. And if it was, for my case, I have the lung cancer patient. I would concentrate mainly on the respiratory system, but I would also, check it for breath sounds, make sure there's good air movement in all fields. But I would also check the integumentary system, especially the cap refill, to make sure that we're oxygenating well. And that concludes my assessment. Thanks.